What's happening? Happy Friday, guys. Hope everybody's doing well. Welcome in to our Friday Q&A. Hope everybody's had a good week. I know I haven't seen you in 2 weeks, but um, this is your time, right? So ask whatever questions you guys want. Anything about performance, fitness, training, assessment, you got it. Fire away. Happy Friday to you. Waving back at everybody. Adonis, welcome back in. For those of you that are my regulars, what's happening? Happy Friday. I haven't had any. We had a course here in Houston last week, so that was our last course of 2021 on to 2022. But hope everybody's done some great things, right? And finishing the year strong and has had a good start of their December. Waving back at everybody. Fire away with some questions. I'm here on YouTube and Instagram. Uh, Best way to check if the sacral iliac joints are locked. You have various assessments. Um, that's kind of outside of my scope for this conversation. So assess. That would be kind of my recommendation. There are a couple videos on the website for you to kind of just check motion, check range. I will say that asymmetrical weight shift is a pretty good sign that shows that there may be some sacroiliac joint dysfunction there, especially if you do kind of like the treatment for or the intervention for asymmetrical weight shift and things are still not getting any better, there may be a deeper layer to that. And that might be some sacroiliac joint dysfunction there. So, that's one of those things that if you are a PT, you can certainly use your training and your um, uh, experience for that. But if you are a personal trainer, um, then maybe that's something that you need to refer out on, right? So you do the overhead squat assessment, you see that asymmetrical weight shift, you do your intervention, and then if it's still not getting better, then maybe it's time to refer somebody out. Um, the TFL stretch, something that's not kneeling, and again, I know some of the videos on the website and some of the stuff that you see, not every client or patient can do those things. So, obviously, I would certainly suggest some sort of mobility work. The massage guns, if they can't get on a roller, they work great for those situations. And then some stretches. There are some standing stretches, and while they don't work really as well, there are some standing stretches that you can do for that TFL. There's also, the modified Thomas stretch. If you're familiar with that, that may be a nice little alternative. They're on their back. But again, it's not perfect, but if that's all they can manage, then that's what they can manage. And that's okay. So, like I said, a lot of the variations and a lot of the videos, we try and give as many progressions or regressions as we can. But like I said, not everybody has that capacity, so you might have to, modify some things to the best of your ability. The other one is the piriformis release. If you've seen that on the website, taking a ball or even a foam roller sometimes in that piriformis is sometimes a little too much for somebody. So they may have to do it up against the wall, or they may have to do it, some other way. And you just do what you can with the person that you're working with. So, can you suggest some good semitendinosus activation? Absolutely. So, semitendinosus is one of those hamstring muscles. It's the medial hamstring group, and typically when we see semitendinosus as underactive or needing activation, it's typically in the sign of that foot turnout in their overhead squat. So if you see somebody who's got foot turnout, it kind of shows that you have that bicep fem that's overactive. So that's that lateral hamstring. Typically, you have vastus lateralis that's overactive in there. So do your releases of those first. Potentially do a joint mobilization. You have doctor in front of your name, so I'm assuming you can do some sort of joint manip at the knee if they're not hypermobile. And then for some activations, there is a tibial internal rotator activation sequence again, that we have on the website for you that creates some tibial internal rotation, which was what the semitendinosis and also semimembranosus will do. So that's a pretty good one. It's one that we do teach in the live course when we do the live course or the live corrective exercise courses. And it's one of those like quick little things that you can do on a table. So you have the band kind of at the wrapped around a leg of one of the treatment tables, and you can pull that band around or off to one side of the table. That gives you that lateral pull, and then you can do your tibial internal rotation against that resistance. So, like I said, check out the website for that one. That it is pretty good. It's one of those that not a lot of people do, and the positioning that we have in there really reciprocally inhibits some of those overactive synergists. Hypermobility. Any tips on training, how to add weight and don't get injured? Obviously, hypermobility is not a great thing, right? It's just as bad as hypomobility, right? But what I would definitely suggest is starting out in that kind of stability endurance phase and really adhering to those tempos, right? So you have this trade-off between having greater range of motion, but by having greater range of motion, you have less stability. So that means that you really need to focus on some of that stabilization and that control, both eccentrically, isometrically, and concentrically, to help kind of prevent some of those injuries that we see when you try and increase the load too quickly or do an exercise that's a little bit too difficult for your capacity. So um, again, just kind of focus on some of that stability endurance phase, right? Really focus on those tempos. It's a 3-2-1 tempo. So 3-second eccentric, 2-second isometric, 1-second concentric. And then, 12 to 20 reps of that. You can increase the load within that phase or even within the next phase of that hypertrophy phase. But just be careful with what you do, right? Again, it's what you were, what you have, and that's not anything that's going to necessarily change. So you just do what you can around whatever limitations that you have, and just be cognizant of not jumping up too quickly when it comes to adding load. Donna, standing TFL side bend against wall, leg that stretches the back. Yeah, that kind of like leaning off to the side into the wall with the leg over. It's not the best, but if that's all they can do, then that's fine. That leg's actually kind of like crossed behind. Um, so you get a little bit of that hip extension plus a little bit of that kind of adduction, which will lengthen TFL in that stretch. So since TFL is a hip flexor and abductor, we want to get into hip extension and adduction. So hopefully that makes sense. And there are some pictures and videos of a standing TFL stretch. I'm sure you can find. Like I said, it's not my favorite, but if that's all they can do, that's all they can do. Great questions. Good stuff, guys. Good stuff. I'm waving back at everybody. Ask me questions. Don't just wave. That's no fun. Um, what else you guys have on your minds? Hi, Deb. Sorry about today. I don't know. Um, it's a struggle. Let's see what else we got here. Um, let's see. Phases of training. Phases of training we run into. You have that stability endurance phase, 3-2-1 tempo. You have 12 to 20 reps, right? The point of that phase is to develop and increase that control of that exercise. From there, we go into that hypertrophy phase where we change that tempo up a little bit, a 202 tempo. And the point there, and it's called hypertrophy, or you can call it general strength. It really doesn't matter. Sometimes people are scared of the general or scared of that hypertrophy term, so we can just call it general strength. And that's going to give them, build up some of that, muscle tissue, kind of build up some um, that hypertrophy-esque, right? And then we go into that max strength phase, potentially, again, depending on the person that you're working with. And from there, typically power is reserved for athletes, but you can certainly add some power-based stuff into people's routines. So those power exercise, power stability, power. You have a couple different variations of power. So yeah, so there's some fun phases of training and progressing, and then we can start combining some things so you can actually combine stability endurance with the general strength where you can do kind of like mini supersets. Because like I said, most people aren't going to go into the max strength or power phase. That's not what's typically what we work with when people are looking for um, you know, either losing body fat or maybe building muscle. So we can start to get creative and start combining some phases together once they've built up a capacity. Um, Adonis, don't ever apologize for multiple questions. That's the point. Keep on asking because that's how you're going to learn. It's awesome. Um, Chest flies, incline and decline chest press. Uh, can I share my opinion on these exercises? Sure. So chest fly can sometimes be a little, you start thinking about biomechanics, right? And with the chest fly, you have a long lever arm, especially if you have somebody with long arms. That's a long lever arm for a muscle that has kind of a short little attachment point on that humerus. So you have an increase kind of force production there at that connective spot, right? That musculotendinous junction. So I think for some people, that chest fly may be a little too much on that joint, right? Now, again, if you're a trained, seasoned athlete, somebody who has been in the gym for years and you're very good mechanics and body control and all that stuff, can you do a chest fly? Sure. Knock yourself out. The workout police aren't going to come get you. But I still think there's better exercises that have a reduced risk of injury instead of the chest fly, right? If you're going lightweight, okay, if you want to do like a little burnout just for whatever, then that's fine. Do those chest flies and get that burn and be happy and move on your way. But it's not going to be the meat and potatoes of my routine. I'm going to stick to my bench presses and all the different variations of pressing, right? So bench press, dumbbell press, machine press, all those variations that are going to fit in whatever phase that I'm working on or working in. So that's going to be the main component of my routine, right? For chest work. So that's kind of my feelings on the chest fly. Now, incline and decline, um, again, with incline, there's just a better, safer way to target some of that same musculature. Right? So you get a little bit more shoulder in incline, so you get a little bit more anterior delt. I'm not a huge fan of overhead pressing. I don't do a ton of it, but I think that's just a better movement than the incline. Again, I think you increase the risk of injury, especially with a high load when you do incline pressing. I think your dumbbell kind of scaption press is going to be a better, safer movement for the shoulder. And decline, I don't have an issue with decline. I know decline and flat bench tend to, I think the research shows that they don't change activity in the pec major. It's pretty much the same. So, I'm much prefer flat bench or floor presses or just dumbbell chest press and kind of keep it simple. I know there's variations and people like to be entertained somewhat within their workouts, so they're not doing the same thing all the time. But that's kind of my feeling. So stick to the standard, stick to the basics, stick to the meat and potatoes of those prime movements of chest press, shoulder press, rows, squat, lunge, deadlift. Like that's pretty much all you got. And you got lots of variations that you can get creative with there. Right. Um, yeah, so I think that's pretty much my opinion on all of that stuff. Right? So hopefully that's helpful. But I like those questions. They're great questions. And like I said, if you want to do incline because you want to do incline, go for it, right? If you want to do decline, go for it, right? But I think for most of our clients or patients, that's stuff that they really don't need to do. Focus on push. I'd rather somebody be able to do a push up than a 200-pound incline bench press. Cool. Spasm in feet and hands. Do you have any advice? Go see somebody. Again, it might be neuro, it might be muscular, it might be, something, right? Previous injury. So you may need to get some additional assessment there, and just uh, kind of go from there. Right? I can't really give you anything. You can try some soft tissue work. You can try some activation, but there may be something deeper there. Squat stance, great question. A Tim train, sorry. Um, in terms of squat strength, what types of stance would you recommend? Um, so second toes, second toes, second toe pointed straight or pointed forward is the best kind of biomechanically sound stance that you have, right? It's all based on length tension. That's really the difference maker here, right? You have to go back to some of those textbooks and start thinking about what length tension relationship actually means, right? So when you take your joints, right, let's say your glutes, because that's the primary mover in that squat, when you take a neutral stance with that second toe over, that second toe pointing forward, you are in that kind of optimal length tension with the glute. Now, when you take a wider stance, what happens with that wider stance is you get into a little bit more of abduction, right? So you have abduction at the hip, and what that does now is it starts to kind of shorten that glute muscular complex, right? So that abduction position in your stance shortens the glute, and a short muscle is actually a weak muscle. So you just by changing that stance, just by taking that wide stance to start, you've taken your force output and dropped it or decreased that potential. So that's kind of why we say keep the second toe pointed straight, and that's going to be the safest, best position, especially when it comes to force output, because you are kind of set up in an optimal length tension. Now, you know, you run into those situations where if you're trying to hit a specific PR or you're competing or whatever, well, that wide stance also shortens the distance that you have to move. So that may enable you to lift a heavier load, right? But you're not getting that full range and you're not kind of optimized when it comes to length tension. And you're going to start to create, if you stay in that wide stance all the time, you're going to start to create compensation patterns. And that just kind of leads you down that rabbit hole of injury. So, like I said, if you're, and this question comes up all the time, um, if you are training for a competition and you have to lift the heaviest thing you have to lift, then yeah, you know what, during competition, right, take that wide stance, right? If you have to hit a number for whatever reason, I don't know why, especially coaches, they don't need to hit a specific number, but whatever, um, then yeah, maybe that wide stance is going to give you just that little bit of a, call it, competitive edge, but I wouldn't train that way all the time. Right. So I hope that answers that question a little bit. Again, every now and then, sure. I will say even the competitive power lifters, they typically, and I've said this before, they typically train in a fairly neutral stance for the most part throughout their training. And it's only until the last couple like phase of their prior to competition they start to go into that wide kind of sumo-y stance. But if you look at some of the deadlifters now, those big, strong world record deadlifters, like the world's strongest man, they tend to not take a wide stance. They tend to actually have their feet kind of in a neutral position. They have certainly wide hips, so it may look like they're in a wide stance. But yeah, that's hopefully, um, you know, hopefully makes sense, right? Yeah, obviously, going back to that chest fly, that pec fly or that pec deck, if you guys remember that, so like that just rips your shoulder blades out. So tend to use cables if you're going to do anything. Use cables for your chest fly. But again, it's all just being comfortable, knowing your range, knowing your capacity, knowing what you can do. What can you do for scapular dyskinesis? So you have common overactive muscles of um, your levator, your rhomboids, your pec minor, so you can do some releases of those muscles. Obviously, do your assessment. I'm going to assume that you have kind of that scapula that comes up and over, and you just have poor mechanics. So, like I said, it tends to be levator. You have levator scap, rhomboids, and pec minor that tend to be overactive. So you can do some releases, right? Take that ball, right? This is our Brook Bush ball, right? Um, and put it up against the wall and do those releases there. From there, do your go into some activations of serratus, go into some activations of mid-low traps. That's going to be very beneficial for you when it comes to just kind of gaining or regaining some control of that scapula. So try those things, see how you feel. I think that's going to be your best at home care. Obviously, if you're still having issues or still having trouble, go see a professional. Go see somebody who knows what they're doing, and maybe give you some stuff that you can do at home in addition to the stuff that I just said. There is some stuff on the website if you want to jump on the website and look at some of the activations of serratus and activation of mid-low trap. That should uh, that should be helpful, right? But make sure you do your releases first. All right, that's really no, impressive, important. Um, so, yeah. All right. Let's see what else you guys got. Good questions, guys. This is great. Ryan, congratulations getting your membership. Awesome. Go use it. Go use it wisely. But one thing, I'm Dave, not Brent. But that's all right. We look the same. It's fine. Uh, DC Romero, how healthy or as important is it to put your clients to squat below parallel? It is not. Um, again, we run into kind of a combative argument there, especially with some strength and conditioning or strength coaches. And now, obviously, if they're competing for sport, they need to hit a certain depth, and that's their sport. But for your average client, you just want to go as low as they can, or at least as low as they can control without compensation or pain or discomfort, right? That's kind of the thing. I don't care how low they go because even if you go up, quarter squats, you're still utilizing the same muscles. Quads, hamstrings, glutes, calves, right? So they're working no matter what. Now, certainly, if you get lower and lower and lower, you're going to utilize more of those muscles in a greater range of motion, which is always good, but it's not necessarily super important to make sure that they do that the very first session. So, do what you can with that person, go as low as they can without compensation or dysfunction or discomfort, and stick to that. And we use that kind of as a metric to constantly improve and get them lower and lower potentially. Ideally, I tend to say you only need to go as low as the lowest seat in your house, which is essentially the chair or toilet seat, and that's pretty good for most people, right? So like I said, if they're competing for a specific sport, they need to hit a certain depth. That's a different story altogether. But see what you can gather, see what you can do from there. Good question. I know there's a lot of info on Instagram that you find um, with squats and squat depth and all that fun stuff. So just stick to the basics. Stick to the things that make the most sense to you. Right? You don't have to have everybody squatting, their butt to the ground. Right? The ball to release the pec or the trap or both. So not trap, it's pec. Well, you can do trap, pec minor. So that ball you got to find a way to get that ball in there somewhere. Pec minor, those spots a little differently than pec major. Levator scapula up here, closer to that um, superior angle of the scapula. It tends to be where that we develop all those knots, especially from sitting. And then the rhomboid, same thing. Take that ball, bring it in between those shoulder blades, and that's your rhomboid release. There are videos on the website for that, so you can kind of walk through those. Vertigo. Go see somebody. I don't have a protocol for vertigo. Sometimes you can't do anything about it. You just got to let it pass. Other times there's something in that vestibular system. It's go if that's not within your scope of practice, refer out. Rotator cuff, two charms. What's happening? It's good to see you on here as always. Um, within the scope of the personal trainer, what should be the first approach for rotator cuff rehab? Um, when it comes to rehab, if they've been cleared by their doctor, if they're in PT, you can do pretty much the same stuff that they are doing in PT. And typically, they send them home with that kind of a at home kind of home exercise program. So you can do some of that. You can also kind of start to implement other things as well. If you have been working with that person for a while and you know their limitations and you know what they can kind of manage, you can sometimes get a little bit more creative than the standard, at home program. Now, obviously, they need to do rehab PT, with a PT uh, for a little while, especially coming off of a surgery or something like that. They're going to have scar tissue buildup. They're going to have, underactive muscles. They're going to have all those things. So you're doing essentially what you can with their rehab kind of home exercise program. But as you progress and as they progress, and maybe even after they get done their sessions with the physical therapist, like when they run out of PT sessions, you can start kind of maybe dialing it up a little bit. You're not trying to do anything crazy. You're not trying to take over the job of the PT. Um, I know they're good PTs and they're just the run of the mill PT. So that's a big thing too, right? If they're just kind of putting you through or putting your client through kind of the revolving door of patients, then maybe they're not getting the best care that they can, and maybe you working with them one on one, you can really dial in that proper form of what they're doing, that they don't necessarily get in PT because there's 1,000 people, in there, and there's two PTs trying to do everything. Um, but you do what that PT tells you to do. You do what their home X thing shows them or tells them to do, and then you can start to slowly kind of progress that as we go. Jen, what's happening? Waving back at you, Jen. It's been a while. Hopefully, you're doing awesome. One of my all-time favorite students of awesomeness. Any suggestions for new physiotherapists? Just keep learning. Um, Nausea, just keep learning as much as you can. That would be my suggestion. Um, you're just as much as you learn, is you're going to do great. So no worries there. Let's see what else we got. Scapular winging, again, is going to be that scapular dyskinesis piece that I've talked about. Release levator, release rhomboids, activate serratus, activate mid-lower trap. Kind of go from there. That's going to be your best bet, right? Cool. Yes, you can apply that same squat stance piece to the deadlift stance piece. And that's my big argument between sumo stance and conventional stance. You have a cat in the background. Um, so sumo stance and conventional stance for that deadlift as well. Same idea. That wide stance, you're going to reduce or shorten that limb tension and maybe not get as much glute as you hope. And that's all right. If that's what you're competing for, then you need that wide stance and whatever. But for most people, keep them neutral. All right. I gotta run, so I'm sorry. Guys, have a great rest of your Friday. Go do great things. I'll see you in 2 weeks. So, not next week, but the week after. Come back with some awesome questions. Phenomenal job. Appreciate all of you guys for tuning in. Come back with some more questions, waving back at everybody. Thank you for my regulars. As always, go do great things.